All right, I guess we can get started. All right, welcome everybody to week 1, Thursday of Machine Learning for Healthcare. So for those of you who weren't there last time and Tuesday, nothing big. So what we did was just basically take a look at the healthcare and the industry of healthcare and how AI can make impacts. So a lot of our opportunities lie in the deep learning. Because of the power of deep learning, we can make a lot of potentially make a lot of innovation in the healthcare industry. So data algorithm hardware already, and let's change healthcare. And as I said, we need to save both lives and costs. So that was basically it. As a reminder, please join Classroom. So I've made a post on KLMS about the Zoom link and the slides I used from the first session. But yeah, I'm probably gonna do that for this week. But after starting from next week, I'm just gonna use Classroom only. So please join Classroom using this participant code. And as I said, yeah, everything will be announced in Classroom. And for those of you who've never used Classroom, let me just share a screen. Looks like this. So it's classroom.com, and then when you join Classroom, you will need the invitation code to enroll yourself in this webpage in this session, and then I'll be uploading slides and videos every single time after every class. And you can ask questions, and the announcements will be there, and everything will be done on Classroom. So please join Classroom using this code. And I think I've made this post on KLMS, but just to make sure, I'll just check again after this session. All right, so today we're going to talk about electronic health records. So because all our projects or assignments will be done via electronic health records. So this is just something that we need to cover as soon as possible. So today we're going to look at 3 electronic health records datasets. One is Mimic3, another Philips eICU, and lastly, Korean National Insurance Claims. So we're just going to take a look at what they are, what their structure looks like, and just to get familiar with the overall concept. And why today? So gaining access takes time, actually, because Mimic3, all these are actually open source dataset. Not this one though. This is not free, but these 2 are free. But even though they're free, they are sensitive dataset because they're patients' health records. So there's privacy issue here. So if you want to gain access, you need to go through certain steps. So and that's going to take at least like a couple of days. If you really hurry up, it's going to take a couple of days. And yeah, as I said, all future examples will be based on nature. So let's take a look at them. So what is Mimic3? Mimic3 is records from intensive care units. Intensive care unit is 중환자실. So that's where you go when you're really, really sick. So like if you're like, severely injured, or you have like a really severe trauma or something, then you end up in ICU. So Mimic3 is mostly intensive care unit records, and it was collected from Beth Israel Deaconess Medical Center, which is in Boston, I think. Because Mimic3 was open sourced by MIT, and MIT is in Cambridge, which is right next to Boston. And I think this is in Boston. So it's like a close local collaboration. And it consists of records from over 40,000 patients. And it was collected from the year 2001 until 2012. And it contains vital signs such as body temperature, blood pressure, your rate of respiration, which is like how often you breathe, something like that. And then lab test results. So lab test meaning like your blood test samples or urine test samples. Medications, what kind of drugs were given to you, and caregiver notes. So like when you're in the hospital, especially when you're in the ICU, like nurses come to check on you maybe every 8 hours or maybe every 4 hours or something like that. So when they come, they make a a simple note, like your complaints or what your states are. So the free text notes are also part of this. Imaging reports. So when you go to the radiology department while you're in the hospital, like sometimes when you're in the hospital, you have to go down to a certain, like, underground level, and then take an X-ray or MRI or CT scans. So, and when you take those images, usually it comes with a report. So this is also a free text note. So imaging report is also part of Mimic 3, but the images themselves are not. So we'll talk about this. So it's just only the reports. And mortality, so whether you died in the hospital or not. So those kind of, like, a lot of information is inside Mimic 3. So accessing, how you can access Mimic 3. So as I said, I'm going to upload this slide in Classroom, so you can click this link. But just to give you a preview, so I'm going to go to this website. By the way, if you have any question, you can, ask, interrupt me anytime. All right. So actually, we can start from here. So when you search for Mimic 3 at Google, then you'll end up here. So when you go to data, the first page you end up is how you can request access. So this takes time. So you can see that there's certain steps that you need to take. And here, what you need to do is you need to complete the required training course, because this is a actual human beings data. So there's something called city training. So you need to actually go through this city program, and then go and then take it's like a online quiz or something like that. Like something that you do when you enter KAIST. You have to do the safety education, 안전교육, right? So it's something like that. So you need to go to this link, and then you have to register yourself, and then I already have my, I can't show you this because I've already went through the city training, so this won't be the same as you guys. But you need to register yourself, and then follow the links and add MIT affiliate course, and you need to choose this one. So human subjects training category, and then data or specimens only research course. So complete the course and save a copy of your. So when you go through the course, and you have to, like, take a quiz every like after every session, and this is gonna take, if you are really careful, like if you read all the text and all the laws and all the legal terms and all that, it's gonna take several hours. But just filling in the quiz is not gonna take that much time. So first, so you need to complete the course, and then you will get a copy of your completion report, which is a PDF report. And so you download that, and then you're going to use this when requesting for access. So once you've completed the city training, and then you have your city certificate PDF file, then you go here to PhysioNet. So, yeah. So so when you go to PhysioNet has a lot of healthcare related data. It's like a warehouse of healthcare data set. It not only has Mimic 3, but it has Mimic 4, which I'll also talk about. Mimic 4, Mimic chest X-ray database. There's another EHR database. There's this is MIT BIH. This is a time series data set that is collected from EKG signals. So EKG meaning 심전도. So when you take the 심전도, EKG, electrocardiogram, then this is what they're about. And then there's another EKG data set. There's like whole different, I think there's like at least more than like 50 or 60 different 50 or 60 different healthcare records, not necessarily EHR, but different modalities. Like, sometimes waves, time series, sometimes images, sometimes like health records, sometimes maybe free text notes, whatever. Anyway, so once you go here in PhysioNet, you need to create your account, register, and then you can fill in this detail, of course. And then when you go to the files section, so when you are, let me see. Oh, this is not okay. So I'm just going to show you what it looks like when you log in. Right. So when you log in, you go to VisioNet data, I think. Yeah, data. So yeah, so when you go to data, there's like whole different, like a lot of different each data sets. And if you go to, let me see, something that I don't have access yet. So because I do have access to Mimic 3, so that's not gonna what. So you and I are gonna be looking at different screens. So I'm just gonna take a look at something that I don't have access to. So you go here and then, oh, this is already, I already have access. Yeah, anyway, so when, yeah, I think I have access to all of these because I went through the city training and I have access to the entire complete data set of PhysioNet. So, but when you first start, you go to PhysioNet, you create an account, and then you go to the data, and you need to find one of the, like when you go to the files, you need to have a, you need to click this one, credentialed user, and then that's when you when you upload your city completion report. This is what you do. So you have to go through the training, save a copy of your city completion report PDF, and then that here, this is when you use that PDF file. Yeah, and while you're requesting access, while you're requesting access, I think you need to send an email. There's like a step where you have to fill in your details, your email address, your why you're requesting for access and that kind of stuff. So that's when you need to provide this information. So yeah, first, when you enroll for PhysioNet, you should use school email to enroll to make everything easier. And then you need to provide school and the course name. So why you are requesting access to a certain database, you need to provide certain information. So just say that your school KAIST and then your course name, AI612, Machine Learning for Healthcare. And then you need to provide your supervisor's name and context. So when you're asked to do that, just type in my name. So Edward Choi, you can use my email. So yeah, and this is going to take at least a couple days so it's not an immediate action. So when you upload your city certificate PDF and then you fill in the detail, provide this information, someone at MIT will take a look at your profile and then they're gonna decide whether to grant you access or not. So when they do, they're gonna ask me that if you are a correct student of this course. So please fill in your details as correctly as possible. So there's no confusion. All right. Any question regarding this process? No. Okay. Hope the no question means everybody understood. All right. So before we dive into, oh, what is this? Did I do this? Where did this come from? Interesting. Did I erase it? Oh, it's gone. I guess someone did this. Okay, that's fine. All right. All right. So before we dive into the actual structure of Mimic 3, first of all, something that we need to cover is de-identification, because as I said, Mimic 3 is a patient health record and it is a sensitive data set. So because of all the laws, privacy issues and the privacy laws, and like every country has this kind of law, like 개인정보보호법, it's always there. So in order for people to not take advantage of these sensitive data set when releasing EHR, the hospital or the MIT people went through a certain number of steps to prevent people from taking advantage of this information. So what they do is as I said, raw EHR holds PHI. PHI is protected health information, and we don't want to share our health info to an unknown party. So, like if you are, I don't know, if you have a certain genetic disease or whatever, if you have certain like illness or like some kind of problem, basically you have a health problem, you don't want some other person to know that you have that problem, because then what could happen when you're applying for a job at a company? They might have access to your health records and they probably don't want to hire you because they don't want to spend medical finance for your health issues, something like that, basically. So we don't. Yeah, basically what we want is we want to open source electronic health records while protecting certain level of privacy. So that's where de-identification comes in. So it's a procedure to make it impossible to identify an individual given some data. So in order to prevent someone from identifying whether a certain person is included in the EHR database, they first of all, obviously, they want to remove all names because hospitals do possess your names, but when they release or open source data sets, they first of all have to rename all names, remove locations, and remove very rare cases. For example, if you are like 20 years old, like 120 years old, then there's probably very, very few people who are actually 120 years old in the world. So you have a pretty good chance you can you can recognize who they are by looking at the data set. Like even if you remove the names and locate where you live, your 주민번호, your names, your date of birth, even if you remove all that information, but if you're 120 years old and that information is in the EHR, then there's a very good chance that someone might recognize that person because, as I said, that's such a rare individual. So this same rule applies to not just the age, but also like very rare diseases. Like if you have a very, very rare disease, like only 5 people in the world have the same disease, then then there's a very good chance that even without all the names and location, someone might recognize you that you are in the EHR. So we need to remove very, very rare cases. So there's certain criteria, like people over a certain age cannot be included, and people with like some disease cannot be included, something like that. So, and then lastly, what a hospital or the open sourcing party usually do is they shift or randomize the dates. So for example, the date of birth. So again, so even without the names and locations, if you have the date of birth and certain other information, then you can combine those information to backtrack who might be that is in the EHR. So they shift the date of birth to completely different century, like someone born in 1964, maybe just completely randomize it and do so something like in the future or in the past. But not just simply just randomizing the dates is not enough, because we still want to preserve the temporal information. So they preserve the internal consistency. So for example, if someone was admitted in the hospital for 2 days, then both original data and the de-identified data will have the same information. So for example, if you shift some temporal information, for example, you send this to like 100 years later, then you need to send every other information 100 years later so that you preserve the temporal consistency. And of course, they also need to and simply shifting like 100 years or 50 years or something is not enough, because you want to also preserve time of day. So if in the original data set you were admitted at 2 p.m. so at Tuesday in the summer, then you still want to preserve that information while you're shifting the dates. So like seasonality, like whether you were admitted in the winter or fall, that needs to be preserved, and which day of week, like Tuesday, Wednesday, Thursday, and like time of day, like what hour you were admitted, and that kind of stuff. So certain criteria are a bit more. It was created with a bit more careful, like with care, because of the sensitive how important the temporal information is. So yeah, this is just an example. This is not the entire steps that needs to be taken, because the identification process is actually a very important step. So in the United States, there's something called HIPAA, HIPAA. So that's a set of rules that must be met before releasing electronic health records. So as long as a hospital meets all those HIPAA criteria, then they can freely open source their database if they want to, and there's no legal repercussion. But in Korea, we don't have that kind of rules yet. So HIPAA, we don't have that. We don't have the Korean version of HIPAA yet. So that's why, as far as I know, that's why hospitals cannot release their data sets. So everything has to be stayed within the hospital network in Korea. So like nobody can share nobody can open source EHR yet. So hopefully the laws will change. Oh, actually, I should have made it into full screen. All right, so that was the identification. So before we go into the Mimic3, actual Mimic3 database, just a recap. So this is usually what health records look like. So there's a patient records at the very top. So for example, this ID could be your 주민등록번호, your national registration number. Yeah. So yeah, that would be your ID. And then when you come to the hospital, like this is your first visit, second visit, third visit, and then when you come to the hospital, you visited a certain date, certain hour, and then you get certain set of problems or diagnoses. And then, as I said, like based on the diagnosis, you might go for for additional lab tests like EKG, or you might receive a simple procedure like IV fluid being 수액, and due to maybe cough and fever, you might receive some medication, some drugs, maybe 2 drugs. So that's usually what it looks like. So as I said, EHR is usually stored in relational database. So there are a lot of the colors actually represent different databases. So I mean different tables. So obviously there's actually no colors represent actually yeah. So the different colored boxes. So colored boxes like patient, encounter, med order, proc order. These represent different tables. So there's obviously patient table where usually it's the patient information like their 주민번호, their date of birth, like their gender, that kind of information is stored in the patient table. And of course, encounter table, it'll contain encounter related information when you came to the hospital, that kind of stuff. So keep that in mind. So when you go to tables of Mimic3, so tables of Mimic3, there are a lot of tables in Mimic3 actually. So I think it's easier if we took a look at the actual website. So we'll go to the website, and when you do have access to Mimic3, actually you don't even need to have access to Mimic, just to look at the tables. So you come here, tables in Mimic. So in tables in Mimic, and then there are I think there were 25 or 26 tables. So we will take a look at the patient table first, which is at the top usually. So patient table, if you go to the patient's table, this is the schema, and there's row ID. So because this will be the primary key. Subject ID is the unique identifier given to individual patients. So in Korea, this could be like 주민등록번호, or maybe hospitals, they have their own unique like IDing system. And as I said, gender, date of birth, date of death. If the hospital knows that you're dead, then date of death might be there. Date of death. So this is like if you died in the hospital, then they have like another column for recording that information. DOD SSN. This is like so SSN is like a 주민등록번호 in the United States. So according to the government, when you died. So like expire flag. Whether you expired, whether you died in the hospital or not, something like that. So very 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 simple information. And then, as I said, below the patient, you have the encounter information, and in Mimic, encounter information is stored in admissions. So admission is another table, and if you go down, there's a schema, and there's row ID. Of course, this is the primary key, and subject ID is actually the same subject ID from the patient table. So this is the foreign key, because this is a admission table. So you need to record who came to the hospital at which day, due to which reason, and that kind of stuff. So of course we need the foreign key. HADM ID is the unique identifier created when you visit a hospital every single time. And then this is the time of admission. So when you visited, when you left, when you died, if you died, and like admission type, whether you came through the emergency department or whether you walked in, that kind of stuff. And what kind of insurance you had, what kind of language you were speaking, what kind of religion you were believing in, and your marital status, whether you're married or not, your gender, I mean your race, like whether you're black or whether you're you're like Asian or white, that kind of stuff. Interesting. I mean, this is interestingly, I would have thought that ethnicity should be in patients because this information doesn't change. So I thought it should be here below gender, but somehow it is inside admissions. Like it could change over time. So that's pretty weird. Like, usually when you normalize the database into different tables, you have to, like, you have to divide certain information that changes. You have to think about the semantics of the information. But so ethnicity, it probably doesn't belong in the admissions, but it's just my opinion. Anyway, so you have this. So there, as I said, so there are 25 tables. So it's probably easier if you had access to the schema of the entire thing. So there is actually a schema table somewhere. Not this one. Yeah, right here. So if you click this, you'll see a schema spy. And so you have the entire tables here. And so we'll go to patients first. And then you can see that the children of patients are all these. So these are where the subject ID is used as foreign keys. So it is subject ID is used as foreign keys in these tables. And you can see this gigantic figure. So you can see that the patient's subject ID is actually borrowed to here. It's landed to here. So it's admissions table. And admissions table has its own admission identifier, so which is given to which is used in ICU, which is used in a whole different tables actually. So we'll take a look at the overall structure first. So anyway, so I just wanted to tell you that there are certain schema explorers so that you can actually take a look at the entire structure of the mimicry in a bit more high level detail. All right, so moving on. Yeah. And I didn't go through all the different tables, but like admission is where you have admission information. You don't some of the things that are more relevant to our projects or our assignments, and some are not. So some of the things that are more relevant, I should point out, is like diagnoses, like what kind of diseases were diagnosed when you went to the hospital. Lab events, like if you took a lab test, like urine test or blood sample test, then those information will be stored in this table. Prescription, what kind of drugs were given to you, that information will be stored in this table, such and such. Yeah, we won't go into details. So we will take a look at these details when we announce the projects, because you will have to use like a subset of these tables when you're doing the projects. Okay. So we need to actually take a look at the admission patterns, because this is actually quite confusing. Because as I said, mimicry is an ICU record. So you need to actually understand how you end up in an ICU, like 중환자실, while you're in the hospitals. For example, let's say this is patient 1, and at certain date, this patient, I'm just gonna assume this is a male patient. So he went to the hospital at January 2nd, and then hospital admission is usually 입원. So 입원 is different from 중환자실, because 입원, so admission is you stay in the admission ward, 입원 병동. So where they're like 1인실, like 2인실, 5인실, like a different, like if you have, like depending on your financial situation, you end up in one of those wards or facilities. So that's where this patient stayed for 1 day before he went into ICU. So 중환자실 is different from 입원 병동. So 입원 병동 is where you stay and then you get the regular checkups. But if you're really sick, or if there's like something really severely happening to you, then you are transferred to the ICU setting. So that's where you 중환자실로 실려가잖아요. 이게 이제 그거죠. So so after 1 day in the ward, you are transferred to ICU, and then you stay. So this patient stayed for 8 days in the ICU. 중환자실에서 8일 있었던 거죠. So ICU. And then after the ICU, so if the patient is stabilized or something was taken care of, then he is transferred back to the ward, to the 병동. So this is what you call a ICU discharge. So this is ICU admission. This is ICU discharge. So ICU에서 퇴원한 거죠. ICU discharge. And then after one more day in the hospital ward, the patient was discharged from the hospital completely. So 이거니까 이제 요거는 이제 ICU에서 나온 거고, 요거는 병원에서 나온 거예요. 요게 두 개가 다릅니다. So ICU discharge and hospital discharge, they're different things. And usually all these information, like hospital admission, ICU discharge, hospital discharge, all these information is stored in the EHR. So this is pattern 1. So this is completely possible. This is the simplest case actually. You go to the hospital, you end up in ICU, you exit the ICU, and then you exit the hospital. This could be a bit more more severe case. So the patient goes to the hospital, stays in the ward for 1 day, goes to the first ICU admission, stays there for 6 days, thinks that the doctor thinks that the patient is stabilized, so he is discharged from the ICU and goes back to the ward. So 병동으로 다시 가고, and then stays there for 3 days, and then then patient 2, something again happens to the patient, like some kind of shock or whatever, and then so he is transferred back to the ICU. So this is the second admission, and then stays there for 3 days, stabilized, discharged from the ICU, then stays in the hospital for 2 more days in the ward, and then go discharged from the hospital. So this is like a pattern, typical pattern number 2. So what I'm trying to say is within a single hospital admission or a single hospital stay, multiple ICU visits could occur. So for this patient, 2 ICU visits, but it is certainly possible if 3 or 4 or 5 or maybe even 10 ICU admissions could happen. So yeah, that's something to think about. Of course, this is also possible. So if we have data, then we can track the lifetime admission patterns over the patient. So for example, if patient 3, this is patient 3, so he went to the hospital, went through the ICU, and then discharged from the hospital, and then maybe 6 months later or some number of years later, goes back to the hospital for maybe a different reason, and then goes to the hospital, and then stays and then goes to the ICU again, discharge and discharge. So this is certainly possible. You can actually track a single individual's visit pattern over time in Mimic3. You can do that. This is also possible actually. So this is kind of an unfortunate case. So patient 4 visits the hospital, goes into the ICU, and then expires during the ICU stay. So expire meaning dead. So something severe happened, and then the patient could not recover, and then dies in the hospital. So this is actually both expire and discharge at the same time. So when someone is dead, then that's actually a discharge. So actually, you can say that patient 4 was discharged from the ICU with the status of expiration. So you can there is actually like a test called mortality prediction. So for example, like when you go into the ICU admission, then you take a look at like very first few hours of information, maybe 12 hours or maybe 6 hours worth of information, and then you try to predict whether the patient will die in the hospital or not, so that maybe you can take a different action. So this is mission number pattern 4. Right, so this is a couple of different examples of admission patterns. I mean, there are, of course, there are like infinite amount of patterns, but this is just few typical examples, just to give you the idea. Like hospital admission and ICU admissions are different things. And yes, as far as the table goes, so some tables, as I said, there are 25 or 26 tables. So some tables are related to admission. So this is admission level tables, and some tables are more related to ICU level. So this is hospital level, and this is ICU level. And then there are some tables that are related to none of them. So we'll take, first of all, admission is obviously it's an admission related table because it records when you're admitted, and like, so this is a hospital level thing. Diagnosis is also a hospital level thing because diagnosis code, like what kind of diseases you had during your stay, this diagnosis, this code is given to you at the time of discharge. So at the time of hospital discharge. So when you're all done with everything in the hospital, and then you get discharged, you get this diagnosis code And this code is used for reimbursement. So as I said in the first class, hospitals charge subset of the actual amount of hospital fee to you, and then they get the rest of the amount from the government or the insurance company. So in order to do that, they need to have the code for asking for the money, basically. So that's reimbursement. So this code is given to you at the time of discharge. So this is more like a service fee. Lab event, patient is also, this is also like a hospital level thing, and the prescription is also hospital level. Certain things, well, I mean, if you take a look at if you play around with the MIG3, you will easily understand why certain things are hospital level and certain things are ICU level. So just to give you just talk about maybe one or two ICU related tables. So chart events is, as I said, when you're in the ICU for every certain number of hours, like every 6 hours or every 8 hours, at least nurses or your physician, your 담당 의사, come to you to check on you while you're in the ICU. So, and then they write some, like, like brief reports, like what kind of problem you have, like if something some kind of like something changed on you, like your body temperature changed, or maybe your blood pressure changed. If something's changed, then they write that down in the report. So that kind of things are all stored in chart events and note events. So note events contains free text form information, so things that nurses and doctors wrote down. And chart events is anything that is like structured, your body temperature, your maybe your respiratory rate, your SpO2, your O2 saturation level, so 산소 포화도, your 호흡수, your 맥박수, so your heart rate, your respiration rate, body temperature, or maybe like your certain level of like ions, like calcium level or like potassium level or that kind of stuff. So those are all in the chart events. So these two are like the most relevant things that happen to you while you're in the ICU. And these are definitions. So for example, DICD diagnosis, what this does is, diagnosis ICD table contains the codes like ICD-9, something called ICD-9 diagnosis code. It's an international code. So, and code is not legible by people. So for example, like ICD-9 code 401.9 is not something that people understand. So they go to the could you stop annotating on the screen, please? Yeah, I'm just gonna clear that. Yeah, so as I said, so the definitions of the code can be found here in the DICD diagnoses. So this contains the code, the mapping between code and the actual textual description. I guess I can show you what I mean by going to the ICDs. Right, so if you go to the ICD-9 data, there's, for example, if you look at 401.9, right here, so this code 401.9 is actually recorded in the diagnosis table, but its description, which is unspecified essential hypertension, which means that 고혈압, basically. So this textual description is stored in the right here and in here, D underscore ICD underscore diagnosis. So you can actually join this table with this table to take a look at, to make it easier for you to look at the code and the description at the same time. All right, so yeah, this is the overall structure of the MIG3. And yeah, the scheme. So any questions so far? No? All right, okay. Yeah, yeah, sooner or later, you're gonna have to download the MIG3 dataset and then take a look at the raw data, the CSV files anyways. And or you can actually download the database themselves, like so that you can query using SQL. So you're gonna get familiar with them anyway. So yeah, additional information, schema, we already took a look at the schema explorer. And another thing is something called query builder. So there's an online platform where you can explore the MIG3 dataset using SQL query, SQL. So actually, we can do this again. Query builder, which is in, where's my, well, here it is. So we can go to the query builder and take a look at them. I think it's in, yeah, querying Mimic 3, tutorial querying Mimic 3. It's weird, data details, tools. Oh, here it is, so tools, query builder. Yeah, you can go here. And yeah, this actually requires you to have access to Mimic 3, because in order to query or explore Mimic 3, obviously you need to have access to Mimic 3. So, all right, so there are a lot of tables here. It's all the tables that you've already seen, and I'm just gonna show a few examples. So select everything from patients. Patient, is it patients or patient? It's patients. From patients, limit 1. Then yeah, so here, actually I shouldn't be showing you this at all because you guys don't have access to this, but hopefully this just one example is okay. So row ID, subject ID. So row ID, subject ID, everything is gender, DOB, date of birth, date of death, date of hospital, SSN, expire flag. So this is all here. So someone is subject ID 249 is female, and the date of birth is, obviously this is date shifted. So she was born in 2075, which is in the future. And DOD, so date of death. So obviously at the time of collecting Mimic 3, which was based on records from 2001, between 2001 and 2012, this person was not dead yet. So DOD none. Actually, let's just query one more example. Query from admissions. Yep, so here, this is admissions table. And so subject ID 22, so which we can query using, which we can query from patients table. So subject ID 22 had visited the hospital at the time 2196. So again, this is date shifted, and then stayed in the hospital for 1 day. So admit time 9, so April 9th, discharge time April 10th, and so it only stayed in the hospital for one day. And let's see if this patient was actually admitted to the ICU, because within a one day time frame is actually a short amount of time to actually visit the ICU. So we can actually see if this patient was admitted to the ICU at all. So in order to do that, you can actually use the table called ICU stays. So select everything from ICU stays, where HADMID equals 165.315, 165.315. Oh, they actually did end up in the hospital. So in time is not 9th, 12 o'clock in the afternoon, and discharge in the almost 4 o'clock in the afternoon the next day. So okay, so like during the 1 day short period of time of hospital stay, this patient has spent most of her time in her time. I'm not sure if it's a she or male, but just gonna assume her. So yeah, she spent most of her time in the ICU for a day and 3 hours and more. 1 day, 3 hours, 3.5 hours. Yeah, okay, here it says. So length of stay is 1.1438. So again, so if you have access to Mimic 3, you can query, you can poke around and see how these are like structured and all that. So hopefully this is useful. All right, I'm gonna mute everybody again. Okay, so this is okay. So this is Query Builder, and additionally, so there's something called Mimic 4. So Mimic 4 is obviously Mimic 4 is the next version of Mimic 3, because Mimic 3 is, so Mimic has been going on. This is an ongoing project for us quite a long time. So this was actually an NIH project. NIH is National Institute of Health, which is, I guess, What's the equivalent of NIH in Korea? Something. 그러니까 보건복지부 산하의 모임입니다. 그냥 한마디 미국으로 치면은 이제 보건복지부 산하의 어떤 그 건강 연구소. 하여튼 NIH is like a really gigantic research institute that does everything related to health. Not just EHR, but like like biology, medicine, drugs, all that. So Mimic is actually a NIH funded project, if I remember correctly, which is so the Beth Israel Hospital and MIT are collaborating for that project. So it has been going on for a while, and now it's time. So they are releasing Mimic 4, hopefully within this year, maybe. So it's getting, I guess it's being delayed a little bit because of the COVID situation. But anyway, so in this Mimic 4, it is in the beta stage. So I can actually show you the beta stage Mimic 4 as well. So when you go to Mimic 4. So yeah, it's version 0.4, so it's not a full release yet. Mimic 4 Physio. Oh, interesting. Why don't I see this Mimic 4 Physio? Nope. Okay, my bad. Well, where? Oh, here it is. I'm sorry. Yeah, here it is. So if you go to the new Mimic 4 website and then you go to access, you can't. I'm not. I don't think you can access Mimic 4 yet because it's in beta stage. So only like a certain group of people can access it. But things that changed is how the data is structured. So the tables are usually most of the same. It's mostly the same. It's same overlapping tables like admissions, patients, transfers, DIC diagnoses, like DRG. They were also there in the Mimic 3, but the way they're structured is a little bit different from. So now there are 5 main categories. So so these 3 admissions, patients, and transfers, they are part of core data set. So core meaning like it's something that doesn't change over time. And some tables are related to, as I said, some are hospital related. I mean, some are hospital level and some are ICU level. So they actually distinguish between the two. So everything in everything under HOSP, these tables are hospital related, and everything under ICU, these are all ICU related. And everything under ED, these are actually, it's a new category which is introduced in Mimic 4, which is emergency department. So these tables are information collected over from the emergency department. So this is a newly introduced stuff. And lastly, there's CXR, which is chest X-ray. So the good thing about Mimic 4 is that, so there's a database called, actually, let me see, Mimic CXR. So there's another data set called Mimic CXR database, which is part of PhysioNet. And Mimic CXR consists of, do we have the example here? No, we don't. Okay, so this consists of chest X-ray images and the reports. So it is a multimodal data set. It has the image and text that comes along with the image. And this is gigantic data, obviously, because of this consists of a very high resolution images. So it's a very gigantic data set. And unfortunately, until Mimic 3, we couldn't link the image information from this database to the Mimic 3 database because the subject IDs were not mapped from between those 2 databases. But now, thanks to the efforts of MIT researchers, now in Mimic 4, chest X-ray IDs are mapped to Mimic 4 subject IDs. So we now know that which individual took the chest X-ray radiology, and they went to the radiology department to take chest X-ray at which time of day and which, we have the time-stamped information. So now so the Mimic 4 is actually a truly multimodal data set. It has the EHR, it has the notes, it has the codes, it has everything related here, and it also has the images as well. So hopefully this will get a official release within, in the short future. All right, moving back to Mimic 4. So Yeah, Mimic4. So data set consists divided into 5 categories. As I said, core, hospital, ICU, emergency room, and chest X-ray. And as I said, Mimic CX are now linked with Mimic4, and you can. I have provided the link here if you're interested in Mimic X-ray data set as well. Okay, so this is all there is to talk about Mimic so far. So there's Mimic3 and Mimic4 ongoing effort. Philips eICU is a completely different EHR dataset, but this is also in the PhysioNet universe. So it's also records from intensive care unit, and unlike Mimic, which was collected at a single hospital, Beth Israel Deaconess Medical Center, Philips eICU was collected over multiple hospitals across the United States, and this was possible because this was done by Philips, the company that makes, like, you know, 면도기, and like Philips makes a lot of stuff basically. So Philips is, and it has a big chunk of like a big part of Philips is dedicated to healthcare. So they actually make EHR software, and multiple hospitals in the United States, obviously they use Philips software to store EHR, and that's how Philips was able to collect ICU records from multiple hospitals across the United States. They just basically they have their software installed in multiple hospitals. So they ask for permission. Probably they ask for permission from the hospitals. They use that software, that use the software, and then they collected it, and then they worked with the MIT researchers again to open source the data set. So this is a bit more, the size-wise, I mean, patient number-wise, it's bigger. So Philips eICU consists of over approximately 170 hospital stays, but unfortunately, we cannot count individual patients. So we'll talk about this. But in Mimic3, we were able to count how many individual patients there are in the data set. But here in Philips eICU, we can't do that. What we can do instead is how many hospital admissions there are. So we can talk about that. And it was collected over between 2014 and 2015. It contains vital signs, lab test results, medication mortality, but not clinical reports, not report. So no free text notes and no images. So it's a bit more limited. But this is the only other EHR dataset that is out there in the world. So this is like a sister of the Mimic3. So accessing eICU, so you can visit the webpage. Actually, this is because, as I said, this was released by, again, the MIT people. So it looks exactly like that website. So when you go to getting it, so you know the interface is exactly the same. They're requesting access. You can take a look at this, but basically, and of course, the tables are all here. It's just different table because Mimic3 and Philips eICU, they use different schema because they're a different database. So obviously the tables are different, and then there's schema spy, there's tutorial, everything. So it's exactly the same. But the good thing is, once you gain access to Mimic3 via PhysioNet, like, you know, go through the city training, download the city certificate, upload it, and then write email, whatever. Yeah, once you do that, you have access to eICU. So you don't have to go through the same steps in order to gain access to eICU. So that's a good thing. So once you go through that kind of like a hassle of a step, you have access to a whole lot of, like, you know, variety of healthcare records. eICU schema is also here. You can take a look if you're interested. I'm not gonna do that today. So how is eICU different from Mimic? So, but they're both EHR dataset, but as I said, it doesn't contain free text notes, but there's other certain differences. So as far as I'm concerned, what I think the major difference is between eICU and Mimic is that, first of all, eICU doesn't contain free text notes, so no free text notes. So unfortunately, it's not as multimodal as Mimic. So it only contains structured information and no linked images again. So as I said, Mimic. So this only pertains to Mimic4 because Mimic3 is not linked with images. So but Mimic4 does. So compared to Mimic4, eICU doesn't have linked images. So again, a bit of a limitation there. And interestingly, eICU dataset, within the eICU, the diagnosis and treatment codes. So these are like, there was the diagnosis code, there was diagnosis table in Mimic, and there was also procedure table in Mimic. I said that they are not time-stamped. They're only given at the time of discharge at once during the entire hospital stay. But in eICU, both diagnosis and treatments are time-stamped, which is a little bit different. And I think, yeah, one of the major differences, you can't track individual patients across different hospital visits. So this is kind of the things that only you can do with Mimic3. So what I mean is that in eICU, you can, this pattern is recognizable. This pattern is, you can reconstruct this entire pattern, this entire time series using eICU. You can also reconstruct this entire information again using eICU, but this you cannot. So if the same patient went to the hospital like more than one time during the entire lifetime, like, like maybe like first hospital visit at certain point, and then maybe some years later, some months later, second hospital visit, this cannot be reconstructed using eICU, because eICU doesn't allow you to track individual persons visit record, visit history. So all you can do is this and this. So you can you can only track the information within the same hospital stay. So it's I don't know why they did this. Maybe probably in order to maximize privacy protection, or it was some decision made by the Philips eICU people. Anyway, so unfortunately you can't do this. But as long as a single ICU or single hospital stay goes, you can do the same thing with eICU. That you can do the same everything you can do with eICU with. I mean, so yeah, everything everything you need to do, everything you wanted to do, you could do with Mimic. You can do with eICU as well, as far as single hospital admission goes. Right. So that was the major difference. Right. So that's the end of the foreign, or probably the only EHR, open source EHR records in the world, which are Mimic3 and eICU. And actually, that's not accurate, because there are some other open source EHR datasets out there, which is from Amsterdam, so Netherlands. So unfortunately, it's all written in Dutch, not English. So yeah, it's I guess it's like less friendly than Mimic3 and eICU. And if I remember correctly, the Brazilian government open sources their patient records as well to any researcher, interestingly. But again, it's all in Portuguese. So yeah, so I guess Mimic3 and eICU is the only EHR, open source EHR datasets that is based on English. So we're going to do all our projects using Mimic3. All right, so what's there in Korea? So actually, yeah, Korea does have something called the Shimpyeongwon dataset. So Korean National Insurance Claims dataset. So it's how is it called in what's it called in Korean? It's, 청구 data. Yeah, this is called 청구 dataset. 청구 data. So Shimpyeongwon 청구 data. 청구 is the reimbursement. So this is the this is a reimbursement process. So claim. So why is it called 청구? Why is it it's called claims data? It's so this is a process that the hospital usually goes through. So this is a patient, this is doctor. So let's say that you're a doctor running your own business. So this is a K1, not a like a really big hospital. So you're like a K1 의사, and then you see a hospital. So the patient comes to you to talk about some symptoms. So I have a headache. So take this prescription. So this is a practice of medicine. So 이게 의료행위죠, 의료행위. So practice of medicine, and then once you've done that, this patient pays a very small amount of the entire service fee. So for example, as I said last time, maybe the service fee was like 5만 원, but then this patient only pays like 5천 원. So only like 10% of the entire service fee. Then this doctor, the K1, needs to ask for the remaining 4만 5천 원 from the government insurance, which is 국가의료보험. So that's why they do something called submitting a claim for reimbursement. So this person, this doctor, is submitting a claim to the 건강보험 심사평원, 심평원. So this is a health insurance review and assessment service, which is equivalently, I think CMS is what United States government. CMS is a United States entity that does similar thing, I think. Anyway, so he or she, let's say the doctor is just like a male, so he claims, he makes a claim. So I did this kind of service to this person. So physician, my name is John, and the patient name was Mary, and the date of the practice of medicine, the 의료행위날, was something like September 10th. Diagnosis was headache. I prescribed Tylenol, and if I did something else, like if I gave a injection, like 주사, then like the 주사 was like something else. Like you list out things that you did during this medical service, and then he files this information to 심평원 to claim for the remaining 45,000원. And then 심평원 takes a look, assesses this report, and see if whether this guy is like overclaiming or underclaiming. Like people actually, like there are certain situations where physicians overclaim to get more money from the 심평원. Like they would write stuff that didn't really happen during the medicine. Like 수술 안 했는데도 한다거나, like if or like they didn't do any operation, but they write that they did, or they say they prescribe a really like expensive medicine even if they didn't. So to ask for more money from the 심평원. So 심평원 needs to take a look at all these like details and then see if it's legit. See if it looks okay, then if it looks good, then here's the payment. So the 심평원 gives the doctor like 45,000원, the remaining fee. Right. So this could be a doctor, but this could also be a pharmacist or acupuncturist or midwife. So pharmacist being 뭐죠? 약사, pharmacist. So the same process needs to happen to 약사. Acupuncturist is 침솔 놓는, 미국 같으면 이제, so in the United States, acupuncturist is actually like there's like a job. So 침 놓는 사람이 따로 있죠. 산파, midwife. So like there are a lot of different providers. So and as long as you as a patient or client go to a health service facility that is insured, that is covered by the insurance, then that facility goes to the same process. Like if you go to 도수치료, for example, if you go to 도수치료, then you get the chiropractic, all the services. Then the chiropractor needs to go through the same process. They file a claim to the insurance company or the national insurance government entity, and then they get the payment. So yeah, so the same. This process goes all over every single time in the hospital industry. So, and claims data is, it's 심평원 has collected this data, this claim file from the individual hospital or individual doctors all over the country, and then they compiled it into a database, and then they released it for like a research purposes. So that's what Korean National Insurance Claims Data is. Basically a compilation of this thing. So here, that thing looks like this actually. So it's a 명세서. So maybe you've seen this before, maybe you haven't. So claims data. So this is a Korean National Insurance claims that contains provider information. So the doctor's name or doctor's license, like service license, that kind of stuff, and patient information, obviously. So your name, your 주민등록번호, your insurance number, that kind of stuff, and then what kind of diagnosis. So what kind of problem you had when you visited the hospital, and what kind of treatments was given to you, and your billing information, what kind of what level of insurance you have, and if you have like private insurance, like 그 개인 보험 있으신지 뭐 이런 거. 네. If you have private insurance, like all these information is like all filled in this form. So obviously this is it. This is like your name, provider's information, your information, diagnosis, treatments, and billing information, and that's it. So it doesn't contain notes. It doesn't contain lab results, your blood pressure, or your weight, or your height, or your body temperature. It doesn't have that. It doesn't have charts. It doesn't have images. It doesn't have anything. It only has this information. So it's a rather very limited data set compared to actual EHR. Yeah. I think there was a chat here. Is there English version of the claims data set? In Korea, no, obviously, because this is Korean data set, so everything is in Korean. But in the United States, CMS, so actually, let me just go to the CMS website real quick. So what is CMS? CMS is a government entity which runs Obamacare and Medicare and Medicaid. You can see Medicare and Medicaid. So I think one of them is Obamacare. So anyway, so they, as I said, CMS is a government entity that runs the insurance for the really poor people or the really old people. So in the United States, if you're healthy and young, you're on your own. So you have to get a job to get insurance. If you don't, you'll end up paying a lot of money to the hospital. So anyway, so CMS and CMS, so obviously Medicare and Medicaid, these are insurance plans. So the same processes happens for CMS as well. So in United States, if you're a physician, like if you're like a K1, and if you treat a patient who is insured by Medicare or Medicaid, then you have to file a claim to the CMS government entity to get the reimbursement. So obviously CMS contains a lot of those claims data. So they actually open sourced a synthetic version of that claims data. So it's called SynPuff. So it's called Medicare Claims Synthetic Public Use Files. So it's synthetic. So it's not the actual claims data. It's synthetic ones. So it's they probably went through a lot of ways to randomize dates and like de-identify and shift, like jump, like permute the columns and rows and stuff. So all you have access to is actually the form of the claims. So it's for practice only. Like even if you train a predictive model based using the SynPuff data set, it won't work because the statistics wouldn't match with reality. But at least you have access to the format. So if you click this, you go to all right, this is taking some time. Yeah, if you click this, then yes, you can. I've never downloaded it myself, but you have to go through certain steps again to go. I don't think they require CD training, but they require some number of steps to actually get your hands on the data set. Is it this one? Yeah, this is a slow. Yeah, so yeah, you can see that there's like a lot of samples here, so you can probably download this. Yeah, but it's very, very similar. So there's beneficiary summary. So your patient information, if patient was like 입원했으면 inpatient. Inpatient means 입원. Outpatient means 외래. So outpatient is like 외래 환자는 이제 그냥 그날 왔다 그날 나간 거고, inpatient은 이제 입원한 거고. So inpatient claims, outpatient claims, carry. I'm not sure what carry claims. I think this could be insurance related, and the drug like if you went to the pharmacy and then you get the prescription relation. So these information is like more or less the same level of information as Korea claims data set as well. So, but again, these are all fake. So if you are really in a dire need to get your hands on English claims data, you could use this, but keep in mind that this is fake. All right, so going back to the original, So no English version of Korean insurance claims data. So you can obtain this from a website called HIRA, HIRA. So it's a health insurance assessment and review service. I guess this is like a subdivision of 심평원, I guess. I'm not really sure. So, sorry about that. Unfortunately, it's not free. The downside of the Korean insurance claim data, it's not free. You have to, there's a lot of limitation to the 심평원 data, the Korean claims data. First of all, it's not free. So they release this data year by year. Like there's 2010 claims data, 2011 claims data, there's 2012 claims data, something like that. And you have to pay $300 per year. So it's not free, even though it's our data set. I don't know why they charge this they charge us to looking at our claims data. So $300. And the another limitation is you cannot. So patients from 2 consecutive years are not linked. So as I said, this claims data is released year by year. There's 2010 data, there's 2011 data, and the patients in the 2010 are not the same patients in 2011 sample. So like. So it's obviously when claims data, when HIRA released the claims data, the open source, they released the claims data set. They didn't release the entire citizens data. They only sampled a subset of the entire citizen of the Korean nationals. 그러니까 국민 전체를 오픈 소스한 게 아니에요. 한 10,000명, 1년당 10,000명, 1년당 10만 명, 뭐 이런 식으로 이제 how many like subsets. So, and as I said, so it's year by year subset of the Korean national citizens. And as I said, the like 2010 samples are not the same samples as 2011 samples. So the patients are like not the same. So you cannot do a longitudinal study. You cannot link a single patient's entire insurance trajectory over years. That's not allowed. So there's a lot of limitation. So, but yeah, you can, but it's okay for single year analysis. Like if you can download like 2010 claims data and then try to see, do like a statistics analysis, like what kind of disease was like most prevalent in 2010, or what kind of drugs were most prescribed in 2010, something like that. So you can do like seasonal studies or maybe something like, but you cannot do a individualized study using claims data, unfortunately. So yeah, we're not going to do anything with claims data because it's not free, and what we're interested is in like individualized longitudinal analysis. All right, moving on. So yeah, okay, so this is not much of an assignment, but this is something you must do in order to gain access to Mimic3. Is please complete the city training, gain access to Mimic3, and please download all Mimic3 tables to your local hard drive so that you can do all future projects using your local files. As a kind of to make sure that you actually did this, please complete the city training, download the city certificate PDF version, and upload to KLMS. I'm going to open the KLMS submission link after this class. So please upload your city certificate, and the due date is 2 weeks from now. So I'm sure 2 weeks is really more than enough. It usually takes about a couple hours to finish the city training, get the city certificate. So please do that. Finish it before this, and then upload your city certificate to KLMS. And then while doing so, request access to Mimic3. And yeah, please do that. So this will be your first lightweight assignment. Oh, and one more thing is actually to make things easier for the MIT people, because as I said, someone at MIT needs to look at your profile and your request access, and then give you grant or reject your request. So in order to make that easier for that person, I actually contacted them, and then they asked for a list of students who will request access to Mimic3, so that I can give that guy the entire list, and then he can take a look at if someone requested access, then he or she is in the list that I provided. So please, after this, I'm going to actually I think I can go to KLMS and then download download a list of students, and the linked KAIST email ID. So that's fine. So those who enroll to this class and wants to get access to Mimic3, that's fine, because I can download the list from KLMS. But those who are auditing or people from Naver, if you want to do the projects with Mimic3, please, you need to do the same. You need to go through the city training, all that. But before you request access to Mimic3 to the MIT people, please share your information to me via email. So please share your name, your full name, and then your email that you're going to use to register or enroll in PhysioNet. So you need to send both information to me via email, so that I can compile the entire information and then send that to the person responsible for reviewing your request. So okay, so hopefully this is clear. So again, I need to make sure that for those who enroll to this class, when you enroll yourself to PhysioNet, you need to use the KAIST email in order to minimize the confusion. And those who did not enroll, or those who are auditing, or those who are from Naver, please share your email with me, and that email must be the same email that you use on PhysioNet. Okay. All right. So hopefully this is clear. So okay. So this is the end of the class today. Any questions so far? How many people do we have? We have 55. So okay, so at least 25 people are missing this information. So I'm not sure how they're going to gain access to Mimic3. Yeah, okay. If there's no question, then we can end the class and they will resume next Tuesday. And next Tuesday, from Tuesday on, we're gonna study how we can use MIG3 dataset to actually build a predictive model. And after that, we're gonna do the project number 1. All right, see you guys. Have a good weekend and see you guys next Tuesday. Bye bye. 네, 수업 전에 올려드리겠습니다. 근데 뭐 주로 이제 밤에 이렇게 수정을 하기 때문에 아마 뭐 며칠 전에 올려드리긴 힘들 거예요. 네. 네, 알겠습니다.